Hey gang, it's Dr. Jarrod Frank here, and today we're talking about a topic that's all over the internet right now, and that's this relatively new device called Emsculpt. And to give a real quick, brief review before I go into the details, this is basically a magnetic field device, very similar to an MRI, and what it does, it stimulates the motor neurons to build muscle. One of the great side effects of the treatment too is in select areas like the belly, it also removes some fat, about 15% of the fat layer, but most importantly, for the first time ever, we are able to build muscle definition and muscle mass. And right now we've been using it and it's FDA approved for use in the abdomen and in the buttock area. So it's basically like a professional trainer. It's great for these people that have low body mass index, that are fit and are just looking for that extra little edge that their trainer or their SoulCycle instructor can't give them. Now, going on to more advanced aspects of this device, we have been using it in this office at P. Frank MD for about 5-6 months now. We've learned some new tricks, and now that a lot of providers have it, there are a lot of people who may be dissatisfied with treatment or are not really the right candidate, so I wanted to give everybody some tips about how to get the most out of the Emsculpt device. Now, like with any procedure, the most important thing is being the right candidate. Whether it's CoolSculpting, sculpture, tumescent liposuction, or any treatment of body sculpting, it's really about, are you the right patient? And this is not a weight loss procedure. It's not for people that are not in shape. This is for a procedure for someone who's already at their ideal body weight, maybe just has a little pinch they want to remove, but most importantly wants to increase muscle definition and lift, both in the abdomen and in the belly. So if you're looking for a shortcut, this is not it. This is for the type A personality with diet and fitness that really wants to take it up to the next level. Now, one of the biggest concerns is also how the treatment is done. This is a machine where you're basically strapping on a transducer like this that goes on your belly or on both buns, and basically you're setting, I don't know, you probably can't see on here how it's set, but it's basically a 0 to 100% in terms of energy delivery. Now, unlike CoolSculpting or sculpture or some other devices, you can't just strap this on and have the provider leave the room. It is very important that someone stays in the room with you at least half the amount of time or is very regularly checking in, because you have to look at this device like a professional trainer, the best professional trainer you've ever had. And I call my providers, my nurses, my physicians, my medical assistants, PAs, I call them Emsculpt trainers, because the job is to start you at a tolerable level, challenge the muscle with increasing intensity as the treatment goes onward. So any provider that straps you to this machine finds a point where you can tolerate it and then leaves the room for a half hour, you are getting an incomplete treatment and you are wasting your money. You have to have an appropriately trained Emsculpt trainer, and you have to look at this like any new workout that you're doing. Let's pretend you hired this new trainer, he or she comes highly recommended. They're not going to just give you the exercises and then leave the room for an hour and then come back. No, they're going to guide you, train you, start you at a low level, and push you based on what your tolerance is and what the quality of your workout is. And this is what you need when you are using the Emsculpt. You need someone who is going to monitor the quality of muscle contraction and the intensity, because it's not just about getting the highest level. You go from 0 to 100%. Often the people that are in the best shape can tolerate the least energy. They don't need that much energy to get that peak optimum contraction. People who are in less shape, they may be able to go higher because they need that energy. Like any workout, whether it's SoulCycle or Peloton or Tracy Anderson, you're going to find that the more you do it, the better you get at it, meaning the more you're able to tolerate. And this is what's most important about having an Emsculpt trainer. Someone who not only in each treatment monitors your progress, but also in between treatments, because the goal is to constantly challenge that muscle and give you the best treatment possible. Once you complete your 4-treatment regimen, well, then it's about scheduling maintenance. Again, you have to look at this treatment like having a new great trainer or fitness class that you've been to. So it's really not just a device, it's not just what you're doing, it's how you're doing it. So make sure that if you're not coming to P. Frank MD, at least you're getting it done by a provider that really has a lot of experience in it, and that you get the attention and the monitoring you deserve to give you the best results, to get you the best version of you. So Emsculpt is really a spectacular device, but like with anything else, it is not a magic wand. You have to be the right candidate, and you have to have the right people treating you, and that involves training, expertise, and experience. And that's the type of stuff here you get here at P. Frank MD, and hopefully we'll see you soon. And if you don't come to us, well, at least you're educated about it. Super exciting Emsculpt, and we will see you soon. Bye.